And as I know you're aware, we're holding this press briefing to confirm that Ireland has had its first case diagnosed of COVID-19. We were notified earlier this evening through the Health Protection Surveillance Centre by the National Virus Reference Laboratory of the diagnosis. The diagnosis relates to a male in the east of the country and arises as a result of return from one of the affected areas that's been identified, and in this particular case, the north of Italy. We've been preparing for this eventuality for months, and I've been saying for some time that a case arising here is not unexpected and in and of itself wouldn't lead to any change in our policies or procedures. We're confident from how we've seen cases that have arisen in this way around Europe in particular in recent weeks, being dealt with, being identified early, good public health management, identifying those cases, effective contact tracing taking place, infection prevention control measures being put in place around those cases, that they can be reasonably successfully contained in the majority of cases, and I've been saying that to you for some time, and we can take some confidence from that. And those are the arrangements that will kick into place as a result of the notification of this case this evening. We know that the individual in this case has obviously followed advice, listened to the advice that we've put out in relation to the symptoms, in relation to the travel from affected areas, and identified themselves to the authorities, which enabled the diagnosis to be made. And as I've said to you on a number of occasions, that the most important part of our strategy is an informed, responsive and responsible public who feels they're in a position to respond, report symptoms, report the fact that they've come back perhaps from an affected area, and trust that they'll receive the appropriate care and the appropriate follow-up by the health service. And that's exactly what's happened in this case, and so it's worked well, and we're confident that the systems we have in place that we've worked on, as I say, for months will continue to work well in that regard. We've been clear in the communication that we will be careful in the amount of information that we give you in relation to cases and in relation to confirmed cases, because we don't believe that this is necessarily the last case, but there will be further cases we expect. We will confirm the gender of a case, we'll confirm whether it's from the north, the south, the east or the west of the country, and we will indicate the source of infection, in other words, whether we believe it's associated with contact with the confirmed case, which is not the situation here, or is related to travel back from one of the affected areas. As I say, it was Italy in this particular case. And the reason for this is to protect confidentiality. Protect confidentiality on the part of a patient. Avoid a circumstance arising whereby a person could be inadvertently or otherwise identified and lead to a public feeling that they cannot trust that their privacy will be protected. And that very trust that I spoke about as being an important part of a person's responsiveness to the symptoms is the reason we want to engender that kind of culture and allow people to feel that they are in a position to respond. So we have nothing to hide in the information, but we have something to protect. We have to protect the confidentiality of the people who we serve in relation to this. So we're happy to take any questions that you may have.
Could I start off, could I start off by asking, people who've been in close contact with this man, have all of those people now been contacted and advised what to do next?
So I'll ask Dr. Cuddihy to address you on that.
So we were notified of this case just this evening. So a public health doctor has made contact, and contact tracing will commence as a consequence. And as I've said before, public health doctors are used to doing this type of contact tracing for the likes of measles or meningitis. And we follow established protocols that are set out by the ECDC. And as I said, this, as a consequence, this contact tracing will now commence.
So those people have yet to be notified?
Sorry?
Those people have yet to be notified who were in close contact with this?
It's a process, and we are being very thorough, so it will take some time, but the people who need to be notified will be notified.
Thank you for your Irish here. I'm just wondering, did the hospital travel take any mode of public transport to get back to home, having left Dublin Airport?
So we won't be confirming any of those kinds of details. We've made that clear all along, and I've given you the reasons again tonight why we don't give that information out. So just let me finish the answer I was going to give you. That if public transport is a part of this, that will form part of the contact tracing, and the public health authorities will address that. And if there are individuals who, through public contact, have public use of public transport, have to be identified as part of that contact tracing and followed up, that will happen. And so the contact tracing that Dr. Cuddihy has described is unique to the circumstances of each individual case. So if public transport forms part of the contact tracing, it will be. If it doesn't, it won't.
Sorry, Kate, for interrupting. Is there any connection between this case and the case in Northern Ireland? Do you have any reason to believe
So I've said we.
on the same flight, or?
So as I said, we believe that this case has arisen through travel from an affected area, as opposed to contact with any confirmed case.
Or would they have travelled on the same flight?
So I'm not going to confirm or otherwise that. I'm saying that's the nature of the exposure here. It relates to an individual who's travelled from the affected area, as opposed to contact with any confirmed case.
So it's possible there were two separate flights that came from an affected area into the country?
That is indeed possible, yeah.
At the moment, Alan O'Keefe from the Sunday Independent, at the moment we know it's been reported about the air crew, the cabin crew being isolated from the original case. We know that. So will this now, Dr. Cuddihy, will this involve now a second air crew being isolated for 14 days?
The contact tracing process, as I mentioned, has commenced, and we follow each of the steps of the ECDC protocol for that. And that is a thorough process to identify any contacts that the case may have, and that may include a variety of different settings. So we will follow that process. And
so it's too early to say whether you can get another air crew isolated or not, because that would be part and parcel of your procedure.
Exactly, it's too early as yet. We need to go through that process of contact tracing.
So
could you just give us a couple more steps that you take? You say there's a process, but just to elaborate a little bit about actual practical steps, like how do you make contact with individuals? Speak generally if you like, but give us some detail about the type of things you do, and
The public health doctor makes contact with the case, and from the time the case became symptomatic, we trace the people that they may have come into contact with, and then we assess the nature of that contact, and based on that then we decide which of those contacts needed to be notified and the advice that they need to be given.
Where is the person being treated? Like, for example, can all the hospitals in Ireland take on these cases, or do you have a specific designated hospitals in the state that will take these cases? Like, is the person gone to hospital? Can you just...
Sure. So all receiving hospitals in Ireland have isolation rooms in place and are in a position to assess in the first instance and then treat a case as necessary and as appropriate.
So we won't name the hospital, but is that person now in the care of one of these particular hospitals in the state?
What we can say is that this person is in the care of health service staff and is being appropriately managed.
Okay, so they're not at home self-isolating?
No, they're not.
They're actually in a therapeutic setting?
Exactly, yes.
Yes.
Can you tell us what county the man is?
no. So we'll tell you it's a person from the east of the country. We won't give any more detail than that. We're not going to get into giving any more detail than that.
I suppose it's pointless to ask you, is it Irish or Italian? Of course, you're not going to tell us if it's Irish.
No, I won't. But and rather than me just telling you what I'm not going to do, I'm going to explain again why. And it's in order to protect something, as opposed to hide something from it. So, and the something here that we're protecting is the identity of an individual. To create an environment in which we feel that members of the public can feel free to report symptoms, and free that when they report those symptoms, they're not going to be the subject of unwanted scrutiny and so on, and they feel trust in the service that they're going to be contacting. If they don't feel that trust, they're simply not going to come forward and report. If they don't come forward and report, we have no chance of detecting cases. It's as simple as that. So it's not about a desire to hide something or to not be transparent. We're fully open and transparent. The reason that we don't give further details for some of these cases is to create an environment in which the individuals we want to come forward can feel as protected as possible.
How many people do you think may have come into close contact with this individual? And also may I ask, how many people are being tested here at the moment for coronavirus?
Well, in relation to the number of people who may have come into close contact, that process, as I mentioned, is now underway. So, and as your colleague said earlier, it's too early yet to know the detail of that.
It is worth me just pointing out that the confirmation of this case came, only a couple of hours ago. The procedures that are now kicking into place that Dr. Cuddihy describes, they take some time, which is not to say that they don't happen with any degree of urgency. That's now happening as we speak. There are significant numbers of public health doctors now mobilised in relation to this case, the notification of which was only a matter of a couple of hours ago.
Just about how many other people are being tested at the moment as well?
So the testing, we confirm each week the number of tests that are completed as of the Monday evening of the week in question, and the last number that we gave you was 90. We told you on that occasion, as a result of our anticipated change in travel advice, which did happen in fact on the Tuesday evening, that with a much larger number of affected areas we would expect to see the level of testing going up. And we'll confirm that number again on Tuesday, after next Monday evening, if you like. So on Tuesday we'll give you a new number.
I know the case came to your attention, the Department of Health, this evening. Did the person travel back earlier this week, or was it last week? I mean, did this person come home relatively recently, or what's the...
So it was relatively recently, in that it was within the 14 days of the incubation period. So that's the time period that defines a case. So if it's travelled to the affected areas within 14 days of the onset of symptoms, that's what defines the case.
I think it's probably safe to ask you in terms of this is a person who came forward, who made themselves up, which is great. And this is learning this for us all, and for everybody, and for our readers and our viewers.
Sure.
And that is, can you just say that this is all anonymous? So did the person follow the guidelines of phoning a GP rather than walking into a place, or did they make contact with a medical person in some other way? You know what I mean? You can tell us something that's not going to give away anything. Did they telephone a GP? Did they telephone a hospital? Did they walk in? That's completely anonymous.
Well, it's not, in the sense that this person knows who they are and their family know who they are. So when I answer that question, I'm answering questions about that individual, because they know themselves. They know that I'm talking about them. If I speak in relation to that specific question that you've asked, I'm now talking about their details, the details of which the medical professionals in contact with them have given them absolute assurance will be kept confidential.
Okay, 2 more questions.
As the contract process goes on, yeah.
You said earlier on that you're always expecting a case to happen here. Have you changed your advice to people now, given that there is a case here now? Because the advice previously was about if you've travelled to an affected area and you might be feeling symptoms. Has that now changed?
So we've said all along that we expected a case or cases, and it's not a surprise, not unexpected that we've had a case here tonight. What we would say is that it changes nothing in terms of our approach. We're in containment phase. We've been operating and updating protocols as more information has become available about this disease over the past number of weeks now, and we'll continue to operate those protocols. We've seen them work in other countries. They've worked very well in containing spread, and we're confident that by applying them in the same way here, that we'll hopefully have similar success.
Just in terms of the advice there, because it was previously for if they travel back. So for anyone now, if they feel like they might be exhibiting some of the symptoms.
So the advice has always been that if you've travelled back from an affected region, or if you've been in contact with a confirmed case of COVID-19 and you have symptoms, that you need to get in touch with health services and identify yourself. And that remains the case. That doesn't change tonight.
Okay, last question to Alan here.
I appreciate that the person involved may want their privacy respected and so on, but say, can you not understand how the public might want to know and appreciate being told, say, what public transport or what mode of transport this person was on when they've been out and about among the public and possibly being a source of infection for them?
The process that we go through for contact tracing is very thorough, and one of the aspects of it is that we would identify all the settings, and including any stages of a journey that the case may have made in the relevant time period. And by going through that, we're able to identify those who need to be contacted and given information and advice. So we are now commencing that process and working through it.
Sorry, just on that very point,
Okay,
is there anybody else self-isolating as a
Sorry,
result?
you're trying to get in here. Sorry.
Just want to ask, now we have a confirmed case in the north and the south, how likely are you expecting this to spread now over the coming days?
So as I said earlier, we expect on the basis of the experience in other jurisdictions that we have a high likelihood of containing the cases here with the infection prevention control arrangements that will be put in place around the case, that we are managing, and we expect similarly in relation to Northern Ireland. We have a high degree of confidence about that. So it doesn't change our view in relation to that, but what we're following in terms of advice around the likelihood of spread is the advice that came last Sunday from the ECDC as a result of the unfolding experience as it was in relation to Italy, that the chance of a similar occurrence, which is a widespread community transmission event that was occurring in Italy, they categorised the likelihood of that recurring elsewhere in Europe as being moderate to high. And so we're planning on that basis.
Moderate to high.
That's what the ECDC said last Sunday. Yeah.
Is that your view now that the likelihood of spread would be moderate to high?
So we've built that into our planning assumptions. We've accepted that advice, and that's the basis upon which we're planning. The fact that we now have picked up one case doesn't change our assessment of that at all.
Okay,
And just
sorry,
a question,
Darren.
are there any people, I know the process is underway, but are there any people currently self-isolating in the wake of this individual being?
The contact tracing protocol that I mentioned, part of that is that when we identify close contacts, they are advised to self-isolate, and they also have daily active monitoring by public health, and they're advised, obviously, if they get symptoms, that they make contact by phone with their doctor.
I know the other day you said that some people had been advised to self-isolate in the wake of the incident with the lady in the north. I'm just wondering, has anybody so far been advised to self-isolate in relation to this particular case?
Well, yet again, that contact tracing process is currently underway.
Can I just ask really quickly, just from a practicality perspective, just to maybe reassure people about the process after somebody identifies in terms of treatment? Does it take a long time to get over the coronavirus, and it's similar to the flu in terms of the treatment and the process in terms of becoming well after it?
So most of the experience to date with cases has obviously been in China, and based on the largest case series, we can say that the vast majority of people who contract this disease will only experience mild symptoms. Now, that's not to say that we're being complacent about that. Clearly, there's a component, there's a proportion of people who will suffer more severe disease, but based on experience to date internationally, the vast majority of people will experience mild symptoms only.
How long does it take to become well? Is it patient to patient? Is there?
I think the information on this really is just developing in the days and weeks as we're speaking. We know that on average the time to symptom onset is 5 to 6 days from when the person is exposed to the virus, and then the disease course, I guess, can be anywhere from a week to 3 weeks, depending on which case series you read in the literature.
What's the current figure for suspected cases you're investigating, or possible cases to be tested for as of tonight?
So as of last Monday evening, it was 90, and we'll update that figure again as of Monday evening coming. We'll just do that on a once-a-week basis. We'll give you a total of the number that have been subjected to that kind of testing. I should just stress that for an individual in the public here who hasn't been travelling to any of the affected areas, the chance of developing this illness in this country is extremely low. We've had one case here, so the chance of encountering or coming into it in this country is extremely low. And we want to target our message obviously to the general public, but specifically to people who are travelling to affected areas, or have travelled back rather from affected areas, to be aware of the symptoms and to be responsive in how they report. And if we do that, we think the likelihood of preventing this infection and slowing down the transmission of this infection is greatest. But right now, for the public in this country, the risk of picking this infection up in the community in this country is very low.
So changing the term, up until now it was contained was the term used. Are we now talking about the next phase?
No. So we're still clearly in a containment phase. The objective, which is to direct all of our resources to maximising the chance of picking up any case, irrespective of how ill that person is. And that will continue to be the case until we get to a point, if indeed we do get to a point, whereby there is widespread community transmission and where it is futile and a waste of resource to direct your resources in that way. The strategy then shifts towards what's called mitigation, where you focus on those who've picked up the infection and are most severely ill, and look after those. And the concern, if you like, in relation to mild cases, and as Dr. Glynn has said, that's the overwhelming majority of cases. You're much less concerned about those in terms of your public health management. So we're not at that point yet.